Can you cure scoliosis naturally? As a progressive condition, scoliosis isn't curable, but it's highly treatable. There are two main treatment approaches regarding scoliosis, something I call traditional treatment versus something I call conservative treatment. Traditional treatment offers some non-surgical options, but it's not nearly what I would consider a conservative treatment model that relies on more natural approaches to deal with a more functional approach to scoliosis. The reality is that many cases of scoliosis do not require scoliosis surgery and can be treated in a more natural method using more advanced conservative treatment approaches. Now, scoliosis progresses, meaning as this unnatural spinal curvature gets bigger, and the bigger the curve becomes, the more rigid the scoliosis becomes, making it less responsive to conservative treatment options, making it more difficult for patients to perform certain therapeutic approaches to get a key reductions in their scoliosis that are key for improvement of scoliosis in a non-surgical manner. As scoliosis progresses, the condition becomes more uneven, causing their uneven forces to cause greater effects to the body, and this typically occurs during growth and development. This is where we typically see the progression of scoliosis to occur, is while kids are going through their growth and development. In adult stages, curves can progress, but they tend to progress in later stage life, 50, 60 years of age and greater. And this is accumulation of time and gravity. As the spine compresses as a result of gravity over time, the curve slowly increases its rate of progression, causing more and more problems. And as the patient gets to a later stage of life, they start experiencing pain and discomfort, and they're noticing that the curves are actually progressing. So when we talk about treating progressive conditions, we're talking about managing the condition to improve daily function. And the way we do this is by reducing the curve progression, by stopping it or actually reducing the size of the curve and actually making the curve smaller. When it comes to progressive conditions like scoliosis, proactive treatment is by far the most important thing, meaning if we can treat a curve before it progresses and prevent progression, that is much more beneficial preventing progression than trying to reduce progression after it's already happened. And we know that the natural tendency of scoliosis is to worsen over time. So treatment has to work on this process, has to work on reducing the size of the curve to stopping this progression over time. And we know when we look at scoliosis, there are different types of scoliosis, meaning it affects adults and it affects children. And we know that the most common type is something called idiopathic. And idiopathic scoliosis is where somebody has a scoliosis that's not associated with any clear cause. Idiopathic scoliosis is thought to be multifactorial, meaning it's many different variables can be associated with what's causing the scoliosis to occur, and somebody can have more than one variable, meaning that there's many different variables that can cause the scoliosis, and somebody can have multiple variables, and they're not the same from one person to the other. In fact, we look at idiopathic scoliosis, even though we know it's mostly diagnosed in adolescent stage between 10 and 18 years of age, and it's by far the most prevalent form, we believe it actually starts sometime in their juvenile years, and it starts off with a very small curve. But it's so small, it's almost undiagnosable and progresses very slowly until they start going through their growth spurt. And as they go through their growth spurt, the curve starts to progress very quickly in this stage, and that's when they typically get diagnosed. 80% of all cases of scoliosis are diagnosed as idiopathic, meaning unknown cause. The other 20% are associated with known causes, like a neuromuscular syndrome called neuromuscular scoliosis. Degenerative scoliosis is where the spine degenerates in the adult stage, in the adult life, as a result of asymmetrical degeneration occurring in a specific area of the spine. And congenital scoliosis is when you're born with something called the hemivertebra in your spine that causes a curvature to occur, and that actually happens in utero. Now, the problem is as these curves get worsened and as they get bigger, a lot of times scoliosis surgery is considered as a treatment option. Now, scoliosis surgery is not a natural treatment option. It is where it's a very invasive treatment option that shares a very significant amount of risks associated with the treatment and associated as a result of the treatment. So it could be side effects as a result of having the surgery, and then it could be just a significant effect that happens as a result of the surgery. Scoliosis surgery is spinal fusion, and the goal of spinal fusion is exactly what it sounds. It's to fuse the spine together. Your spine, one of its bare functions is movement. So removing movement is removing the natural ability of your spine to move. And if your spine is designed to move naturally and you fuse it together, you're removing its basic function. And you are making it straighter with these rods and screws and fusing the spine together, but it's contrary to the movement-based function of the spine. It's kind of like you saying you have an elbow problem, and it's like fusing your arm, your elbow together into a perfectly straight position. Your arm is straight, but your elbow can no longer move. You can't argue the fact that the health of your arm is now altered significantly because it can no longer move properly. So you can't really say you have a healthier arm. You may have a straighter arm, but not necessarily healthier. So we can argue the fact that spinal fusion may make the spine straighter, but is it really making the spine healthier? And since the person has a loss of spinal flexibility and range of motion, this can affect the quality of their life, and it can affect the way their body's functioning. It can also leave them prone to future complications as a result of this surgery. It may lead them more multiple fusions over their lifetime, where they have to go have more and more surgeries if anything goes wrong. So when we look at this invasive approach to looking at treating scoliosis, it becomes, well, if this is the end stage of treatment, wouldn't we want to do everything we can to try to prevent ourselves from going through this type of treatment? And unfortunately, when we look at traditional approaches to scoliosis, very little is offered to try to reduce the curve prior to surgery, if anything. Most cases are just told to watch and see what happens. If the case is diagnosed in the adolescent stage while they're growing, and it's in one very specific group between 25 and 40 degrees, they may recommend a brace to try to slow down the progression. But outside of that, they're saying most of the cases they're just waiting. And if the curve becomes bad enough, then they will consider surgery. In the adult stage, if the curve becomes bad enough and you're in a significant amount of pain, they recommend surgery. So there's really nothing to say, hey, let's do something to try to reduce the curve to prevent yourself from having surgery. This is where where a more conservative approach tends to come in place. This is where I believe it's where a more natural approach, where we're trying to prioritize function of the spine and reducing the size of curve together. We want to reduce the size of the curve, but we want to retain function. And this is using a multimodal approach by integrating different types of treatments so we can impact the scoliosis on a structural level. We're looking at the structure of the spine, we're looking at the flexibility of the spine, we're looking at the strength of the muscles and tissues, we're looking at the shape of the rib cage and torso, and we want to try to get a reduction in the scoliosis. So when we talk about correcting scoliosis, we mean reducing the scoliosis on a structural level. It doesn't mean correcting it like curing it, because we don't know what caused it. But treating a scoliosis more naturally is trying to deal with the scoliosis on a functional level. A lot of times we use chiropractic care in our program to try to impact the spine on a structural level with specific spinal adjusting on a structural level. We use different types of physical therapy to help strengthen the spine, but also make the spine more flexible. Now, this is not general therapy just to increase back strength, like somebody with back pain or back weakness. This is a structural physical therapy approach. We also may use bracing, but we don't use traditional bracing. It's just trying to slow down the progression. We use corrective bracing that's going to help push the spine into a new position to help improve the shape of the spine and help improve the shape of the torso, so now the effects can become more long-lasting. And lastly is that we use a asymmetrical home rehabilitation program to help stabilize the scoliosis after all of these programs are done, to make the spine strong in this new position. So once you address the scoliosis and all these different facets, you have the ability to treat the scoliosis more naturally and reduce the curvature in size, but not only reduce the curvature, but also improve the function. Because as we make your spine straighter, we make it stronger, we make it more flexible, we make it straighter. So we're reducing the curve and making it more functional. We're actually doing both things, where surgical approaches are more invasive. They make the spine straighter, but they reduce function. And it's this loss of function that has its inherent risks associated with it. So we recommend here at Scoliosis Reduction Center is to treat patients more naturally, less invasive, more specific treatment options designed for their scoliosis to get results in reducing their curve without this unnatural fusion of the spine, lack of movement, lack of flexibility. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.